Before we continue to move forward in the low back pain relief course, I'd like you to learn the importance about pain indicators. You need to know when to stop doing an exercise, or when to stop putting yourself in a certain posture, or when to continue doing an exercise, or continue putting yourself in a certain posture. So I want to make sure when we're performing exercises, we want to push to discomfort, but not push through pain, okay? Think of it as knocking on the door of pain, but not pushing through it. We don't want to injure ourselves more. So it's important to know that if you feel any discomfort past a 5 out of 10 on a 0 to 10 pain scale, you want to stop. 0 means no pain at all. 10 means you need to go to the hospital right now. Also, when you're performing an exercise, you want to think of the green light, yellow light, red light concept. Green light means go. When you're doing an exercise and you feel that your pain is reducing, that you're feeling better, well, go for it. Go for the green. If you notice that you're doing an exercise and your back pain isn't getting better, but it's not getting worse, then yellow, proceed with caution. And then if you notice that your back pain is worsening with an exercise, then red means stop. Don't push through that. You want to also be aware what makes it better and what makes it worse. We touched upon this a little bit in the first video. I want to go over it a little more. So when you're performing an exercise or staying in a certain posture, realize that when you have pain centralized in the lower back or in the middle of the low back, that's actually better. If you notice the pain spreading down the low back into the legs, that means it's getting worse because there's something pushing on the nerve, whether it's a tight muscle or a disc. We'll get into that later. But just know, as you're exercising, if you feel you have pain in your middle of your low back, which travels to your hip, then down to your knee, down to your toes, then please realize you want to stop, because that's peripheralizing the pain. We want to centralize the pain. By knowing this information, you'll prevent injury and you'll have a much better experience in this course. All right, I look forward to seeing you in the next one.